patients that come in that tell me that they're here for, say, high definition liposuction, or they're here for Vaser liposuction. And so some of that is, you know, they don't have a clear understanding of the technology versus the procedures.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
Technology's come a long way, and we also have a lot of patients that come in that tell me that they're here for, say, high definition liposuction, or they're here for Vaser liposuction. And so some of that is, you know, they don't have a clear understanding of the technology versus the procedure. So to them, they've read Vaser, and so patients think, well, I'm getting Vaser liposuction, and if we're doing Vaser liposuction, then I have to have, you know, post-lymphatic massages and these kinds of things, which we do with high definition liposuction.
We use Vaser, and I like Vaser because it sort of liquefies the fat, but it leaves all of the connective tissue intact more. So it leaves your, you know, lymphatic vessels intact more. There's less risk of bleeding and bruising and seromas and hematomas, because all of the tissues that absorb that extra fluid are remaining intact. And so that's the technology that allows us to do the technique of high definition liposuction. Not everybody's a candidate for high definition liposuction, right? So, that's why, when we see someone talking about liposuction, we go into, great detail about, what are your expectations, what is realistic for you. So we have the technology that allows us to do the technique. So, you sort of think about it as some of the more traditional ways of liposuction is if you think about, a cluster of grapes and think of the grapes themselves as the fat cells. With some of the more traditional, techniques of liposuction, it's almost like you're taking your hand, just ripping off as many grapes as you can at once. But I think with the Vaser technology, what it does is it allows us to sort of, pluck the grapes a little more gently.
Yeah.
And so we're not, destroying the stems, that provide the nutrients and everything to the grapes, right?
So now, do you find that your patients will have less downtime because of the advanced technology that you have here?
Typically, what we see is that they will have a little less bruising, they have a less risk of seromas, hematomas, things like that. But it also allows us to be able to do more etching, like etching a six-pack, etching the shoulders, etching your chest, things like that, that you can't get with basically other technologies.
Right.
And then if you combine Renuvion with that, then, I mean, like I said, the sum is
game changer.
So it does sound like the Vaser technology is a lot safer maybe than some other technologies out there.
I think it decreases your risk.
Yeah.
Right.
Which is, at the end of the day, priority number one over anything is safety. Absolutely. Right, is your safety. So we invest in the technology to make it as safe as we can.